sorry about that. This is the Chanele ball assessment video, just having issues with the tripod and the 360, but we are good to go now. So, some abnormal vital signs that were noticed when the 63-year-old female presented to the ER was that she was hypertensive and tachycardic. This could all indicate that this patient is going under some sort of stress and the body's fighting back, whether that's anxiety, panic attack, or MI, heart attack, etc. I'm just going to ask you some quick questions if you don't mind.
Yeah, no problem.
Have you experienced any shortness of breath here?
No, I don't think so.
Okay. Any abdominal pain?
I have a stomach ache right here in the middle of my stomach.
Okay. Any chest pain?
I have an ache in my upper chest.
Okay. Any nausea, vomiting?
I am nauseous and I did vomit once.
Okay. Any dizziness or anything?
I just feel tired.
Okay. Do you drink at all? Alcohol?
Well, I'll have a glass of wine with dinner sometimes, dear.
Okay. Do you drink any caffeine, like coffee, tea, anything like that?
Oh, I'll have one coffee each day.
Okay. Okay. And your bowels are moving okay?
Yeah, they're normal.
They're normal? Okay. Are you on any medication?
Oh, yes, a bunch of them.
Okay. Any allergies to anything?
No.
No? Okay. So visually, this 63-year-old female looks well. She's answering questions appropriately. She's making eye contact. I visibly can't see any notes of jaundice, cyanosis, or anything like that. No scars, no lesions, or anything like that. I'm just going to lift your shirt up and take a look at your belly here. Okay, not distended here. Soft, which is good. I don't see any notes of JVD or pulsations or anything like that, which is good. So I am just going to listen to your heart and listen to your belly, if that's okay.
Okay.
Just going to listen for the S1 and S2, and then we'll evaluate the murmurs afterwards. Perfect, and we'll go back and listen for the apical pulse. That would be noted in someone that had a pulse deficit. I'm just going to have a quick listen to your belly here, okay? Okay, you have active bowel sounds in all 4 quadrants. In that lower right quadrant, that's kind of where your appendix would be. In that upper right quadrant, that would be where your gallbladder would be if you had a gallbladder, which you don't. In the left upper quadrant, that's kind of where your spleen is. And in that lower left quadrant, that's where your colon is. I just want to evaluate to see if you have any murmurs really quick, okay? We'll just flip it over to the bell here. If we did hear a murmur, it'd be some sort of slooshing, whooshing noise as well. Beautiful. No evidence of that either. I'm just going to kind of percuss, which is I'm just going to tap on your belly here, okay? So in those areas where your solid organs are, where kidneys, spleen, that sort of thing, you're going to hear more of a tappity-tap dull noise. And in those areas, kind of where your descending colon is, in that left lower quadrant, that's when you're going to hear more tympanic noises because there's air and floating things going through there. I'm just going to palpate and just feel your belly a little bit. So I'm just going to use 2 and 3 fingers. I'm only going to go 1 or 2 centimeters. You let me know if I'm bothering you, okay? I can't feel any sort of hard mass or anything like that. We'll readdress the OPQ or STU, your pain scale again as well. Don't feel anything there, which is good. So you're a 63-year-old female that has entered the emergency department with chest pain and epigastric abdominal pain after eating breakfast this morning. You did vomit once at home. You are tachycardic and hypertensive as well, but you don't seem like you're in any sort of visible distress at this current moment. When I was listening to your belly, all 4 quadrants of your bowels were active. I didn't hear any heart murmurs or S3 noises or anything like that. No visible cuts, scars, lesions, or anything like that on your belly. I didn't feel any masses, and it was all dull and tympanic throughout via percussion. So my recommendation would be that we get a set of lab work, we get an ECG done, and we maybe put you on telemetry and frequent vital sign monitoring, just so that we can keep an eye on you and get down to the bottom of what's going on. I would make sure that you're up in a kind of semi-Fowler's position like you are here, that you're comfortable, you have a vomit basin and everything like that, you have enough blankets, as well as that I could be indicated that the doctor would order all of those things like lab work, CBC, BMP, extended lights, troponin, liver enzymes, and anything like that, just to rule out what's going on, because this could be a myocardial infarction versus a GI issue, whether that's splenomegaly, so inflamed spleen, versus kidney stones, versus some sort of cardiac issue as well. Do you have any questions for me? No? Okay, awesome, thank you.